Hi, how are you? My name is Kelsey. I'm a pediatric nurse practitioner, and thank you for joining me on this long form content that I am now exploring. I am happy to have you. If you are a patient or somebody I know in real life, I appreciate you joining me on this little chat. I am going to speak on the nursing experience, my journey, how I got to where I am today. I'm a pediatric nurse practitioner. I have my doctorate in nursing practice, and I am certified in pediatric nursing. So I am board certified, licensed, and I have a long journey of several years in the nursing world. I started as an LPN and now I have my doctorate. So it's a very long journey, so many experiences. I have met so many kiddos along the way, and it's been truly a pleasure. Pediatric care is my passion. Caring for individuals and little ones is my passion, and I'm so glad that I find myself in such a wonderful experience and place where I can care for little ones and babies. And as a new mom myself, I have a little boy named Sunny. He is 7 months old at this point in time, and it's such a beautiful blessing and amazing experience to have a little one and then be a new mom and experience that brand new journey of motherhood, and then also get to care for my patients that are new moms and little ones too. So it's so cool to be in this amazing space, and I want to share that I've learned a lot of things my nursing career, a lot of philosophies in nursing, how they tie into holistic care. My main objective is to teach and share the holistic pathway, the natural pathway of caring for your mind, body, and spirit, and at any age. But with little ones, it ties into everything with development, right? When you speak of raising a kid, raising a child, it's not just one thing. There's so many avenues of growth and development with children. And as a pediatric provider, that is a part of my wheelhouse, educating parents and talking to them, guiding them on how to navigate this labyrinth of growth and development. And babies grow super fast, kids grow super fast, and there's so many philosophies that come from the nursing world that tie into holistic care. I started as an LPN, a licensed practical nurse. Not a lot of people know what that is. It is a vocational technical training throughout the United States. Every state has their own laws regarding licensure for licensed practical nurses, LPNs, and RNs, registered nurses. So in Florida, I became a LPN. It's basically a year-long training, clinical practice, clinical training, pretty much like every day of the week for a year straight. You're pretty much in school. And I did a few years working in the home health setting with babies and kids that have chronic conditions. I did flu and wellness clinics, and I what I really learned from that experience is that I loved pediatric care. So that was number one. And then also, the autonomy and the flexibility of nursing in general. So I really kind of saw that and I was like, all right, this is cool. Love it. I love a little bit of everything from nursing, right? There's the technical skills, learning how to manage a feeding tube. And then the more technical things involving like medications and, making sure everything's safe and all that good stuff. Then, as a registered nurse, you can do more things, and I did do my registered nurse training in school, and that is about a couple years of schooling, nursing specific classes, specialty classes for every avenue of nursing. It's very overarching concepts. It's very intensive. If you ask any nurse, any registered nurse that you know in your life, you know that when they're in school, it is you are there, you are in the trenches learning and getting everything situated so that you understand all these concepts, so many concepts in one package. So Then you sit for your boards and you get licensed. So I got licensed as a registered nurse, and I worked in the hospital setting, pediatric hematology oncology. So hematology is like blood conditions and disorders, chronic conditions like sickle cell disease, sickle cell anemia, and other kinds of anemias. Then also oncology, which is cancers, childhood cancers. So I worked with those patients, learned a lot working in the inpatient setting, even more technical skills. Going from there, I knew right away I wanted to continue pursuing the pediatric field, and I wanted to get my terminal degree, my doctorate degree in nursing. So I pursued a nurse practitioner program that included master's and doctorate level. So I did that, and I did a lot of clinical training in the outpatient and clinical wellness setting for kiddos. And now I have been a working, practicing nurse practitioner in the primary care setting for a year now, and it's been a true blessing. So interesting. Along my journey, I've learned so many things about nursing care. The fundamental concepts of nursing care is holistic in nature. We think of medicine, especially Western medicine, as very technical, very medical, by the book and all that. But then nursing and the nursing concepts really make you take a step back and focus on the patient as a whole. Look at the holistic patient and everything that they need beyond their medical care, and that those things really resonated with me, and I feel like that is the whole point of care. So the foundational nurses, the nursing founders like Florence Nightingale, in her time, she she basically has these theories that we implement today, like the environmental care theory and the cleanliness of a patient's sick room. And she basically, she theorized that having an open window, light in the room, a clean bed, and a clean environment is key for a patient's well-being and overall healing phase. This is something that is so fundamental that we then implemented, and now that is a standard of care. Obviously, now we know more about pathogens, and science and research shows that the way that we clean and manage environments and clean surfaces and sterilize things, those are keys in preventing healthcare acquired infections and stuff like that in the hospital setting. But just going back to that foundational concept, the nurses, these founding nurses, they pretty much theorized and said, hey, we have a patient that's sick, but what about their mental well-being? What about their comfort and all that? And that is so important, and that is holistic care. So right now I work in an integrative practice. So our goals for our patients, for my kiddos, is making sure that the mind, body, and spirit is cared for completely together. So we blend the Western medicine with these holistic practices that are not really seen in Western medicine or prioritized, and they are equal. So I assess my patients, and I make sure that I'm meeting the standards. I use guidance and resources that are necessary, right? However, at the same time, I'm considering everything else I can do for my patients, the mental health, mental well-being of my newborn moms, and checking in and making sure that they truly are okay, and giving them resources that prioritize those things as well. So I'm very proud to be in a space, in a avenue of work that I can do that and implement that for my patients. And that's so awesome. That's what holistic care is. It is all about these things all together. And that's what's really important there. So that's a little bit about my nursing journey. I started as an LPN. I worked a little bit. I became an RN, and then I worked a little bit, and then I went back to school, and then I got my master's degree, and then finished up with my doctorate degree. There's usually a project, a research paper or research project that you you work on. And my research, it was a qualitative improvement focused project. So my chosen topic was on, I wanted it to be on something holistic. So I chose the use of inhaled lavender essential oils for the improvement of anxiety symptoms in children. So I pretty much disseminated data and information that was already out there, did a little bit of a literature review to see what kind of data is out there that kind of indicates to us that there is a improvement in symptoms when we use lavender essential oils. This is a very common essential oil, and there actually is data out there that shows in the use during surgeries, usually very common with children, to have dental anxiety or to be anxious when they're at the doctor to begin with, for any specialty visit, a dentist visit, whatever it is. And there's studies that show that there are marked improvement in the vital signs that indicate anxiety, that they have a decrease in those symptoms. So I thought that was really interesting. So I centered my paper around that, did an extensive discussion on that. And I like to share that with my patients. And I further like to expand the thought process on, okay, so there's proof of that. We don't really see that much in the Western world. There's not a lot of data out there, but my future goals would be including exploring these correlations and these connections with the use of essential oils and different things associated with the holistic component of care. So I think that will wrap it up for now. I wanted to share my nursing journey overall. There's a lot. There's a lot of things that I've seen. I've taken care of a lot of kiddos, babies of all ages, from newborn until the age of 21, which is the age range of pediatrics, if you didn't know. It's been a true pleasure. So this is my passion. I love caring for kiddos. If you are interested in a consultation, I see patients out of the Hollywood, Florida area, Broward County area. That is a satellite office to Ahimsa MD. We are located in Brickell, Miami, Brickell. And I personally see patients out of Hollywood area. So we are concierge style. We take in some insurances, and we're expanding to take more insurances, and we see concierge style patients as well if that was of interest. So we prioritize spending more time with our concierge patients, giving more resources, and all that good stuff associated. But overall, the Ahimsa way, the holistic practitioner way, the integrative way to care, regardless of concierge, insurance, self pay, whatever it is having that holistic mindset at play when we see every one of our patients. So that's the goal, to really prioritize that and make sure that we're encompassing mind, body, and spirit into our care. And that's the name of it. That's it. So I appreciate you listening. This is my first long form video. So let me know if this is of interest, if this seems like interesting to listen to or whatnot. I just wanted to give a little bit of my nursing journey and shed light on that. So anyways, thank you very much. I'm signing off. Again, I'm Kelsey. I'm a pediatric nurse practitioner, focusing in integrative health. And thank you so much for listening. And please follow me for more in the future. Thank you so much. Bye.